Hi everyone, welcome back to Practical Peptides. My name is Erin McFarland. I'm a NASM certified personal trainer and an immune-centric health coach. And today I'm going to talk about peptide scams. Sounds sensationalized, but it is a little tiny bit. But really, honestly, I make these videos to just try to inform or help people feel informed, have access to non-biased information about peptides, because it is an area that is really rife for exploitation because they are largely unregulated. There's sort of that gray area again, like I explained in previous videos, like supplements where it's very easy for people to get taken advantage of. So I just wanted to address a few of those things that I'm starting to see today in this video. And please go back and watch my other videos. Talk about things like mechanism of action, how peptides are regulated, because they're pertinent to sort of what I'm going to be discussing here. So again, peptides are the closest thing that I can, the analogy that I can think of is they're sort of like supplements as of now. They are regulated in different ways. Some are modified to turn into actual prescription drugs, which are prescribed by a physician. Some are compounded in compounding pharmacies that are regulated by the FDA, and some are available for purchase over the internet as a raw lyophilized peptide that has to be reconstituted, and those are not, they are not regulated in any sense by a government organization. So, and I have a video addressing that. But the thing that I'm really wanting to address is that there are all of these, I want to say like quasi-medical clinics popping up now. I wanted to make this video because I'd seen one when I take my son to school and drop him off. And it really made me laugh and realize that this has to be addressed because people are really being taken advantage of by these companies because peptides are such a gray area that they can get away with it. And I don't think that that is ethical and lacks integrity, obviously, when it comes to having the privilege of working with people's health, their bodies. I believe anybody in that industry, myself included, should have extremely high levels of integrity because obviously your safety is the highest priority. And I have seen patients, unfortunately, be treated like they are stupid. And that's maybe sounds harsh, but it's true. And I had to walk away from a situation where providers were handing out prescriptions for peptides that were compounded in a compounding pharmacy that were inappropriate fits recipients for those peptides, and they didn't like that I spoke up about that, so that's okay. But so I'm seeing all of these little, again, they're like sort of like med spas, where they are, very focused on, I want to say like natural, holistic health, like, they're called Vitality or some stupid, ridiculous marketing gimmicky name that is like, well, we're not prescription drugs, so we have your best interest in mind because we don't hand out prescriptions, we hand out hormones, peptides. They're natural, right? And so it's a virtue signaling. If you know what a virtue signaling behavior is, basically saying I'm this good thing, and so therefore I have no ill intent. Well, that's not true. These places very much use their appeal to authority, meaning they sound medicalized, but they're not. Oftentimes it's just like a nurse or nurse practitioner, which certainly those people, those individuals are educated, and I'm not, talking negatively about them, but these specific types of clinics really use that as a way to get people to trust them. And I hear oftentimes working with clients or patients that I have coached that, you know, they go into a doctor or one of these, you know, clinics believing that they're going to actually get help, and that they're not going to be given something that they can't afford, that could potentially cause them harm. And unfortunately, that's just not true. I see it actually more often than not that patients, clients are overspending, and that their lack of knowledge about what is being presented to them is preyed upon. So I really want to have people hear the message of this video be about empowering yourself and feeling like you can always be your own advocate. Never be afraid to ask questions. If a provider, it doesn't matter who it is, a nurse, a doctor, a nurse practitioner, anybody, a personal trainer, a health coach, whatever, if they're telling you something and they're not being fully transparent with you, or they ask you questions you ask them questions and they are refusing to answer you in a way that is satisfactory, that is respectful, that indicates that they are listening to your concerns, then you have a right to walk away. People in this position should never abuse their authority, their position, and so I believe very strongly about that. If I was willing to take advantage of people, probably make more money. But I mean, this is why I went into this role, is because it is very obvious that there's a lack of integrity amongst a lot of healthcare professionals. And again, there are many that are wonderful and that do their job with integrity and pride and respect. But as a consumer, right, as a patient, as an advocate of your own body and your health, you should never feel intimidated by anybody that you're seeking help or guidance from. So addressing these wellness, they're wellness clinics basically. A lot of them are like, they offer, you know, IV treatments for B12 or some crap. Total waste of money. Just don't. I hate seeing people spend money on stuff that is inefficacious and doesn't really have the benefit or the outcome that they think it's going to have, especially for the money that they're spending. It's a good little side note that the placebo effect is very, very, very real, extremely effective. And so someone's belief in the outcome of whatever it is they're receiving, whatever exogenous, external treatment substance that they're getting, stronger your belief in the fact that that's going to have the outcome that you're looking for, the higher the likelihood that you will experience that particular benefit. And do a lot of research on the placebo effect. It's very well known. So if you go into one of these providers, these clinics, and they advertise, oh, these B12 injections are going to give you tons of energy, and you're like, this is it, this is going to work, and then you get it, it could be saline, and as long as you really believe that it's going to work, then it's going to work. You're going to feel energized. That's how powerful the placebo effect is. So that is not to be underestimated. So when it comes to peptides, the scary part is that because there's this association of peptides and hormones, again, a lot of these clinics they do a lot of peptides and peptide therapy and hormone therapy. The association is this virtue of we're natural, we're holistic, and so therefore we have a halo around our head, and we can't do any wrong. We're not going to give you prescription drugs because prescription drugs are the devil, which they're not the devil. As I've talked about before, they definitely can have a place. They can definitely be helpful. Peptides are just an alternative therapy. So a lot of people fall for that. It's sort of like when you see in the store how they have like vegetarian fed eggs. Well, guess what? Chickens are omnivores. So that is a marketing gimmick, but because we automatically think, oh, vegetarian equals healthy and natural, people buy it, people believe it. So marketing people are very smart. Do your homework, right? And that's part of what I'm attempting to communicate in this video, is that these clinics are making money hand over fist by taking advantage of the fact that peptide therapy is believed to be more holistic, which it is in many ways, but also, because they market it that way, people are less likely to have due diligence when it comes to the therapies that they're receiving. So really what spurred me to make this video especially was I was driving my son to school and I saw this sign for a clinic that had popped up. It was called Vitality something. I don't know, they just make stuff up. It sounds sexy. Oh, Vitality, I'm gonna go give them my money. So they had this sign out front that advertised peptide therapy. They had Semaglutide, of course, everybody wants Semaglutide, tirzepatide, which is also GLP-1, Semaglutide, tirzepatide. There's a couple others that are starting to be more widely utilized. And then they advertised AOD 9604. That's what got me to stop. So this was recently, this is 2024 summer. Last November in the very beginning of November of 2023, the FDA outlawed the production of quite a few peptides at compounding pharmacies, through compounding pharmacies. So again, peptides are regulated in several different ways. Those that are available through a physician's office or one of these clinics, these med clinics, whatever, anti-aging clinics is essentially kind of what they are. If they are handing out prescriptions for a peptide or a peptide that is manufactured through a compounding pharmacy that they utilize, that compounding pharmacy is FDA regulated. The peptide is not FDA approved. The facility is. Any compounding pharmacy where a provider is utilizing that pharmacy for its patients to have these prepared has to be FDA regulated. Now, the problem was that when I saw this sign, they were advertising AOD 9604, which I have utilized, I have prepared for clients. It can be a great peptide. It's a growth hormone peptide, so it has a lot of global benefits. And again, not everybody responds to a peptide the same or in predictable ways. It's very individual, just like a prescription drug. Not everybody responds to prescription drugs. So AOD was on the list of peptides that were outlawed to be produced by compounding pharmacies. So as soon as I saw this clinic advertising that they were utilizing AOD 9604, big red flag. That is a scam, which comes back full circle to the title of my video, Peptide Scams. So that means that that clinic is doing something illegal, or at least, I guess, unethical, because they are advertising a peptide that is no longer available to be produced through a compounding pharmacy. But I guarantee, so I looked at their website, and sure enough, they make it sound like it's coming from a legitimate pharmacy. But if they're utilizing AOD and it's 2024 and AOD has been, banned by the FDA for production by compounding pharmacies, that means that they are either giving a placebo, saline, which is quite possible, or they are ordering raw lyophilized peptides through one of the zillions now of online peptide research labs and reconstituting themselves and advertising it as a prescription peptide produced in an FDA regulated compounding pharmacy. So that's messed up. So anybody, and of course everybody seems to be so desperate about weight loss, right? They'll go to, you read all these forums. Been a member on this coaches group, or really like a sort of a biohackers, a lot of people who did my coaching certification are on there. Everybody, like the entire thing has devolved into sort of a crazed discussion of which peptides for weight loss, peptides, weight loss. It's nuts. So people are so desperate for weight loss drugs. They don't care, right? These clinics are popping up and taking advantage of that and saying, oh yeah, we have AOD 9604, which AOD stands for anti-obesity drugs. So when people hear that, they're like, holy shit, I want that, it's gonna work, right? And it doesn't always. It can just be a big waste of money if you don't know what you're doing. So people are really flocking to these places because they know how to utilize the gray area that peptides are, and that's pretty upsetting, and it's very scary actually. So you really don't know what you're getting when you go through a place like that, and they have the balls to be able to say, oh yeah, we have this peptide that anybody can go online and see that it was banned by the FDA, but we're advertising it as though it was being produced in an FDA regulated compounding pharmacy. So part of me just wants to go in there and ask them about that and see what happens, but I think I'm too tired to do that, so I'll just make this video instead. So anyway, I wanted to bring that to people's attention because you can be really screwed financially, with your health when you fall for these schemes that are popping up. So that clinic could just be ordering peptides from China. And again, I'm not dissing peptides from China, some are really good, but just from some unknown source, and someone, we don't know who, is just mixing them up in the back, right, with bacteriostatic water, like I do for clients, right? But I'm transparent. It's like, okay, these are the peptide research labs that I trust. Here's the whole process, here's dosing. And again, there is no universal dosing standard or reference for peptides, except for peptide or prescription drugs that are derived from peptides like Ozempic. There's no guide for providers to say, you know, AOD and each one based on the mechanism of action is utilized differently and dosed differently and cycled differently. So whoever is working with you with peptides needs to know all that, and it's an immense amount of information. Another place where people can really be taken advantage of. So, you know, that's another thing that people don't understand, or they go in and they think, oh, AOD, anti-obesity drug, this is gonna work like instantaneously. Well, growth hormone peptides don't. They are not like a GLP-1 that squashes your appetite. They work slowly over time. They upregulate different, you know, systems in the body slowly or gradually. So a very different mechanism of action. That's why I made my mechanism of action video, so that people understood why understanding that concept is so crucial when it comes to peptide treatment, and really any drug, but peptides especially because they are so different. So I just really wanted to put this video out there so that people could understand that if they are considering, you know, peptides, whether doing them on their own or going through a provider. And again, I like to try to not be black and white. It's not to say that some of these clinics are all bad or nefarious or whatever. People just need to be very diligent and informed, and that takes a lot of time. And these clinics know that people don't really want to spend all day researching peptides or watching peptide videos on YouTube. So they're just like, hey, come buy this thing. And then you may see results, right? Short term, but long term, those aren't going to stick unless, you know, lifestyle changes are in place along with that peptide regime. So some things to keep in mind. Again, I love any questions, comments. Be careful out there buying peptides. As a side note, any of the online labs, there's so many that have popped up, like I said. The one that I really always stick with for myself or clients is Peptide Sciences. They don't pay me anything. That would be great if they did, but they don't. Or send me some peptides to try. But they have a very strong history, third-party testing, you know, manufactured in the United States, very transparent. So that's who I tend to use when I'm dealing with peptides. So thanks for tuning in, guys, and I appreciate your time, and please like, subscribe, share, and I will see you next time. Bye.